the way our manual is structured, it gives you an introduction to the overall module. It has some highlights for what should be accomplished. So when you're doing your planning, you know, like these are the 5 things that ultimately we're going to be working on, and you be orienting your families to this as well. Managing emotions, emotional reactions, disruptive behaviors, positive parenting, and being able to deal with support more school success. So then it's session by session. And the disruptive behavior module has 5 sessions, individual sessions. Please note that sessions can be done one each week, or often it'll be you introduce it one week and there might be a follow-up or a practice session, we call it, the following week, where you're following up those techniques and further deepening the skill acquisition or removing obstacles that got in the way of them doing it in the first place, of not being able to do it in the first place. And then you just progress through a certain sequence. Out of all of our modules, the only ones that have a fixed sequence is in the beginning you do treatment planning, at the end you do celebration, right before that you do your trauma narrative. All the things in between you can kind of flow based on what's clients need. Some people need affect regulation first. Some people need school success first. Some people got to hop on the behavior. You know, as soon as you finish treatment planning, you will use your clinical judgment. But we open with case conceptualization and we conclude with the narrative when we've built up the skills to be able to do that. And grief, as Karen, I think you had asked about this, the grief module can be done in one of 2 ways. When you get to the trauma narrative, either it's sessions that are at the end of the narrative that you incorporate into your standard trauma narrative, or there's a whole grief module for those who need more extensive work, which is an additional optional module that you can use, which consists of 5 sessions. So you'd use your clinical judgment. Some of you would feel like the grief issues I can address within a standard narrative while I'm addressing other stuff. Some of you may say, like the young boys who were mentioning, they've lost so much, we're going to add this module as part of the overall trauma work. And the grief module can be done before the trauma narrative, or it can be done after the trauma narrative, depending on whether you want to introduce a much more intense grounding in grief before we do the trauma narrative because you want to incorporate it there, or you feel like, let's get this trauma narrative done first. Let's build up some, a framework and a skill set, and then let's extend it to grief. Does that make sense? And grief and loss, as you saw in the video, might mean death, can also mean ongoing or prolonged separation, whether it's through mass incarceration, whether it's through deportation, whether it's through the separation from parents in a child care system, whatever that may be, which can include, but is not limited to, death. You'll outline what you're like. This is the behavior management session 1, and there's 2 sessions of behavior management. You'll talk about parenting styles. You're going to talk about misbehavior, reaction to trauma, and routines and structure. So then here's the clinician guide. This is what you would read in preparation. So it talks about how the importance of structure and homework and routines, some troubleshooting. It says if you're concerned with responsibilities and rewards by the family, what are some steps you could take to develop a better system, how you can help them, and emphasize a charting. It kind of gives you a framework. It gets you ready for some common problems. Then it gives you a script. And so for a typical 45 to 60-minute session, you spend about 30 minutes on the intervention activities to really, embed the skills into what you're doing. And then if you want to follow up the next session, you can, but you want to make sure you're trying to do something different to make life different, if that makes sense. And this is what you're reinforcing. So we talk about the teen goals of misbehavior. There's a handout about that I'll show you in a bit. Then you explain to the parents that to identify goals, you got to identify feelings, because that's a big part of what you want is how you feel. And that link between the emotion and the behavior is a critical one. These are things you probably already know in terms of the framework. This is just rooted in the disruptive behavior.